What explains the unchecked proliferation of this illegal industry to an extent that people now consider it a common practice? Are the laws of this country not strong enough, or is enforcement a question? Clinics that were raided for unethical medical practices just 4 months ago in Indore.
ये कहाँ से मिली उनको डिग्री?
Fake degree certificates, allopathic drugs, all recovered by the Indore administration when it bust practices of 17 such quacks, 4 of whom had no medical qualification.
ये डिग्री भी संदेहास्पद है.
And others who were practicing allopathy without a formal degree.
Information नहीं थी और ये 11 years से practice कर रहे थे.
11 साल.
Despite laws under the Medical Council of India Act, such regulatory actions have been far and few, and even their effectiveness is questionable. In this case, despite raids, not a single offender has been served an FIR till now.
सोसाइटी में जो अलग अलग दबाव समूह है वो काम करते हैं. जब हमने 17 क्लिनिक्स पे कार्रवाई की तो ऐसे ही दबाव समूह ने हमारे ऊपर भी कार्रवाई की और ये जो 3-4 पिटीशंस थी, कंटेम्प्ट पिटीशंस थी, ये भी उसी का भाग था.
The problem experts say is lack of strict punitive provisions and mixed legal precedents against quacks.
Person who is practicing modern medicine without a degree, fine up to 1,000 and punishment up to 1 year. So all state medical council under that, they try to act, but that action is incomplete because this is a bailable offence.
And hence, quacks get back to their practice. On Spycam, we found that homeopathic doctors who were booked under quackery for prescribing modern medicine and let off after a warning continue to irrationally prescribe list of allopathic drugs, including antibiotics. For its part, state medical councils have anti-quackery cells. However, experts say 95% of their jobs is only restricted to registering the doctor.
To get after people who do not have qualifications practicing as doctors becomes a very, very difficult thing for them to do. They do just enough, maybe 5 or 10 cases once in a while, to keep the record straight that they are doing something, knowing full well that these cases will not hold any, you might say, the scrutiny of a court.
What's more, the ignorance of patients to file complaints against quacks leaves scope for exploitation. And since actions are initiated based on complaints and not suo moto, it is a blame game, from administration to IMA to State Medical Council.
Complaints are far and few. On a suo moto basis, how many times we can go and register FIR against these people? Somebody who has been aggrieved by their treatment or has suffered from their treatment has to come forward and do this kind of a complaint to us.
IMA is not a regulatory body to check the work is of Indian Medical Council. Unless the government has a political will to eradicate quackery, it will not happen.
So is it a lack of policy or even a lack of political will? The Clinical Establishments Act 2010 mandates registration of all private clinical establishment, a potential weapon to block quackery. But only 10 states, including Madhya Pradesh, have adopted it so far. And even there, implementation has largely been on paper.
The National Health Policy 2017.
Recently launched National Health Policy 2 has nothing on controlling quackery. So does all the high decibel government health campaigns leave the vulnerable exposed to frauds? Is completely removing quacks from the system a solution then? Come to think of it, in West Bengal alone there are just about 40,000 qualified doctors, but over 1.5 lakh quacks. So should the government in turn be looking at acknowledging their presence and training them? "80 kilometers from Kolkata is village Ashapur in South 24 Parganas district, where an interesting project is underway. A group of unqualified medical practitioners have assembled to free themselves of the indignity of being called a quack.
আমরা যেসব আরএমপি ডাক্তার আছি আমাদের জন্ম
We are a creation of shortage of doctors and worthlessness of government. People call us doctors, we are not.
থেকে আমাদের জন্ম আমরা কেউ ডাক্তার হতে চাইনি
And so they have gathered here to seek medical training by not-for-profit group Liver Foundation. Through a video conferencing once a week with a senior doctor, this group of quacks, along with 3 other such centers, is being trained in the basics of human anatomy, physiology and drugs. But with a caveat. Post the 6 months training, they cannot use the doctor prefix before their name and limit their practice to just primary care.
With lessons on how to diagnose a disease, what are the basic symptoms they must look at, when is it that they must refer a patient to a senior doctor or a hospital, these informal training centers are training on an average around 300 to 400 such informal health workers, trying to teach them to move away from their unscientific method of diagnosis and treatment to a more scientific one.
Till now, the foundation has trained 2,000 such informal health providers.
We are engaging in a better discussion with our patients.
I've learned more about organs and illnesses.
The result so far has been encouraging.
So linkages of the villages to the healthcare facilities had been strengthened.
A World Bank study on the program also reported a positive outcome, showing increase in correct case management. However, it did not reduce the use of antibiotics or unnecessary medicines. For a country with skeletal basic healthcare facilities, particularly in rural areas, could this be the solution? The state of West Bengal thinks yes. It has rolled out a program across 7 districts that will conduct a 6-month training to 3,000 such quacks, who will be designated as primary level health workers. The key ethical question: will this legitimize an illegal practice?
Question of legality comes only when we are dealing with medical training. So it's basically we are training health workers. So if you can train ASHA workers, if you can train auxiliary nurses, midwife, then why can't you tell informal providers? And I strongly believe this is a paranoid conception.
So while West Bengal is rolling out this program statewide, Bihar is also experimenting, and so is Andhra Pradesh. But then there are a lot of questions and criticisms attached to it, particularly from the trained qualified medical practitioner side.
IMA is not with it. IMA is already challenged. We are in the Supreme Court and High Court on many states matters, similar matters. You cannot train anybody in 4 months or 6 months.
IMA will not be able to be successful unless they motivate their own brethren to actually go into rural areas and work at least once in a week, twice in a week. So this is also a demand with the IMA.
In absence of an effective system of reporting adverse medical events, India has a poor record on regulatory enforcement, even against qualified doctors. So tracking the practices of these trained health workers will be the biggest challenge of this program.
We brought you stories from Madhya Pradesh and West Bengal, but unqualified medical practitioners are as much a reality in the rest of the country and in urban cities of Mumbai and Delhi as they are in rural India. Some places it's the necessity that breeds them, in other lack of law enforcement. Unless the government really strengthens its primary healthcare services, appoints more doctors in rural areas and sharpens its focus on law and enforcement, the dream of providing quality healthcare for all will always be a dream. With this, we wrap up this special show, Bad Medicine. Many thanks for watching.